Hello, let's do another health update because I'm home now. I came home on Thursday, so because by Thursday I was off oxygen, and also they think they found the culprit. Well, they have two possible causes, which I'll get into in a minute. But yeah, I was already kind of not feeling like I belonged in the hospital. I mean, I kind of did because I did need oxygen for a bit, but at the same time, I was not bedridden. I was not like unable to do things. Like I can wash myself, I can feed myself. Like I did not need to be in bed all day. So I was a little bored, so to say. Also, hospitals are kind of intended for people that actually are bedridden and are just in bed all day. I was not. I avoided being in bed except for sleeping. So I was just, sitting up or walking around, and the chairs there, they're meant for visitors for a short period, not for sitting at all day. So I was kind of bored with being at the hospital, so to say. But then they were like, yeah, we think we found the cause, and you're off oxygen now, so you can go home today. So I did. And as for the two potential causes, um, they're thinking it's either COP, which is cryptogenic organizing pneumonia. Cryptogenic means that they don't know the exact cause. The most likely option is that I had a virus, my body cleared it, but my lungs did not get the memo, so they were still attacking it as if the infection was still there. So hopefully the prednisone will reset my body basically and tell it like, chill, we don't need to fight this anymore, it's gone, because they did not find any virus or bacteria or anything like that. So hence the cryptogenic part. The other option is what they call hypersensitivity pneumonia, which basically means that I'm allergic to something and my lungs respond to that like an immune response. So most common causes do not apply for me because one of the most common ones is sometimes called the Burt-Fancier's disease, because people are allergic to like bird droppings. I don't have birds. I don't have any pets at the moment. I used to have cats years ago, but that's been quite a few years. So it's not that. Sometimes it's people that work with chemicals or solvents that develop that, but it literally could be anything. It could be some of the paint I've used in my house. It could be some mold somewhere. It could be like any number of things that my body just decided that it's allergic to, and that gets a response from my lungs. That's fighting it as if it were an infection. So, and that's also treat it with prednisone and see how that goes. And if it goes away, that means it's most likely the COP. If it doesn't go away, it's most likely the hypersensitivity. And in that case, we'll have to figure out what I'm allergic to. I don't think I've used like any different detergents or anything lately. I might have been using some different cleaning products, but also not in the past 2 months or so since this started. So we'll just have to see how it goes. Just for the time being, I'm doing better. I'm still not fully there, definitely not fully there yet, because I still run out of breath really quickly, so I have to really pace myself. My saturation levels are still like around 90, and ideally they're going to be a lot higher. So it just takes some time. We're waiting for the prednisone to do its thing, and I'll be on prednisone for quite some time still. Unless it doesn't end up working, then we'll have to switch to something else. But you have to wean off prednisone if you take higher doses anyway, so I'll be on that for a while. And yeah, it's just a waiting game. So I'm doing better. Definitely doing better. Still definitely not there yet, but hopefully no more trips to the hospital and stuff. So I'm doing better in that regard. So I'm just gonna keep pacing myself, keep exercising, but not overdo it, and just yeah, hopefully clear out this completely. So yeah, that was it. So basically, I'm not in any real danger, but it's still inconvenient. That's basically what it comes down to, and it will be inconvenient for some time still. So while my body works through this. But yeah, if you watched till the end, thank you for watching, and thank you for all the well wishes from everyone, and I'll just see you in the next one. Bye for now.